Hi, all. Just wanted to review our info from last week. One quiz question. There was only one that folks had gotten wrong, and then moving on to week 5. So week 4 we talked about training and education. I thought that everyone had some really interesting thoughts in the discussion with regard to training and education. And I'll just one last thought, and I kind of mentioned this in the discussion board as well. But when you're thinking about training and education in the healthcare setting, there really is there are some people that just have to have it. We have to spend the money for them in order to keep employee morale up. We have to spend the money to keep them up to date. So, clinical personnel, nurses, doctors, different types of therapists, respiratory, physical therapy, etc., coding folks, all the different types of folks that in order to keep their license or certification, they need continuing education units. There's nothing that's more defeating for an employee but be told that they have to have a license, but hey, as an employer, we're not going to help you to keep that. So that's one thing as a manager is really important that we need to support our employees so that they can maintain their licensure, their certifications, et cetera. They work very hard to get that. And if we don't care enough about it to spend a few $100s each year to help them keep up their education, then it can be bad for employee morale and cause employees to look for other locations that will do that for them. But we also talked a little bit in the discussion and in the readings about general professional development. And it can be really important to employees to have them feel comfortable that they have the resources needed to be able to move up within an organization. I think someone had mentioned in the discussion about someone that was perfectly happy, had been in the same role for 20 plus years, wasn't interested in moving up, and not everybody is. But even for folks like that, just being able to develop professionally, take different types of classes that are being offered, maybe online options, really important overall. One thing that RMU started doing, unfortunately, as you all know, financially, we're not in a great situation, but they did start offering um, some training classes that our staff could take for free. So if you worked as a staff person at RMU, you could go online and take, there were classes for all different types of software programs like Microsoft or Adobe or Dreamweaver or those types of things. But then you could also, Photoshop, I think was another one. And it was an online class to teach you how to use that software product and get you a certain level of expertise. But then they also had some that were about, dealing with difficult people or, better ways to deal with stress, all different types of things that from a personal professional development standpoint might be really helpful. Not something that's required, doesn't cost the organization much at all, but really gives people, if they're interested in more development, it gives them that option. And it really does, it has made a difference for some of our staff. Had the opportunity to speak with one some time ago and talking about how, there isn't money for raises and those kinds of things, but at least they can go to school for free at RMU. They can get some of this professional development for free. So it does make it a little more tolerable when there isn't the money to give someone a raise. At least they have some additional benefits. So generally, the professional development stuff is really important for most people. Some won't take advantage, but others will, and that's an important piece. So we'll go over this one question quick. What is true of a departmental new employee orientation program? So when you think about new employee orientation, especially in the healthcare world, everyone's required to go. You learn about things like, actually, like this thing here, this second answer, which was incorrect: organization structure and leadership, benefits, dress codes, infection control, all of that stuff. You're going to get that in your general new employee orientation to the organization. But what really should happen, and sometimes this does and sometimes it doesn't, when the person, the new person starts at your hospital, they go first day, first and second day, whatever, go to the organization-wide orientation, they learn all of this. Then what's important is when they arrive on the unit, oops, sorry about that, I hit the screen and it went away. When they arrive on the unit, they also have an orientation, and they need to have, it can be somewhat informal, but it would be much better to have it be a little more formal, in that you can go over policies with them that apply in the department, different types of equipment and processes, and then just an introduction so they can get an idea of who works in the department, an introduction to the space, where are things, etc. So those are not the types of things you're going to have in this um, general organizational new employee orientation. You're going to cover those things on your unit. And as a department manager or a supervisor or a charge nurse or whatever it happens to be, that's likely going to be your role in that setting. So important to know, and we need to make sure that we are orienting our people not just to the organization overall, but also to our own units as well. So let's flip over to week 5 here. So in week 5, we're going to talk about employee relations, performance appraisals. This is going to go on to next week as well, I'm fairly sure. But the one thing that I wanted to share, and I said that I would share this in the announcement this week. I'm not a big fan of performance appraisals. I don't think that most places do them well, and it's therefore not helpful to the employee. But so I had an experience when I was very young, my first true full-time job out of school, where I worked for a health insurance, they're a third-party administrator, but like a health insurance payer, group health plan payer. And I had a boss that once gave me a bad review because you may have heard this story before. You probably did if you were in my 1275 class. But they gave me a bad review because instead of I wore penny loafers all the time. This was the early 90s, so it was in style back then. And instead of wearing socks with my penny loafers, I wore knee highs because I usually wore pants to work. So I wore knee highs with my penny loafers, and she gave me a bad review on my overall annual performance review because I didn't wear socks. Now, there was no dress code that said we had to wear socks, and that had absolutely nothing to do. I was not in a public-facing role. I processed health claims for a living, but she just didn't like that I didn't wear socks, and ultimately that impacted my ability to get a raise at that particular time. So I guess and you'll learn about performance appraisals during this week and next week. But the key is to have specific goals that the employee knows at the beginning of the appraisal period that they'll be expected to meet. Like, for example, if she had said to me a year prior to that if I didn't wear socks 90% of the time, I was going to have an issue on my performance appraisal. Of course, she didn't say that because it's ridiculous, and you shouldn't have to wear socks unless it's part of part of some sort of dress code. But if she had said, okay, well, I'm looking for you to process 120 claims a day. I'm looking for you to make sure you're getting your continuing education done in a timely manner. Like the specific goals that the employee needs to meet. That is what we need to be evaluating in a performance appraisal, and it needs to be clear to the employee at the beginning of the appraisal period. So then at the end of the appraisal period, the employee can assess their own compliance with these goals, and the manager can make an assessment as well. With the situation that I faced many years ago, my assessment of my work was pretty good. I did a very good job there, so good that I ended up being promoted. Thank goodness I didn't have to work for her anymore. But I ended up being promoted because I was very good at what I did, and it had absolutely nothing to do with what I wore on my feet. So just kind of a note of caution, and a reminder when you are doing your own performance appraisals for folks that will work for you or do work for you. Keep that in mind, that unless the employee knows what the goals are up front, it's going to be very hard for them to meet those in the long run. So we have a discussion this week about the lack of consistency in scoring, and how you can deal with that. And then we have a quiz and our ed puzzle. Don't forget about, and here let's move forward here. Don't forget about, I thought that we had No, maybe we don't. I guess I took that out. We used to have a longer project that was due in week 7 in this class, but we don't have that anymore. So no worries there. So the discussion, quiz, and the ed puzzle are all that you have this week. So if you have any questions, please let me know. Otherwise, I will talk to you in the classroom. Thanks.